Irene Beam knows a lot about numbers. As a certified coder in health information management at a Kennedy, Texas hospital, she deals with numbers all the time. But it was her own numbers Irene really needed to be aware of. At age 53, her weight was creeping up and her health was at risk. Irene didn't even know.
I really neglected myself.
When Baptist Healthy Solutions came to her workplace to screen employees, Irene learned her cholesterol, blood pressure, and blood sugar numbers were all elevated.
It all hit me. Everything was in panic mode. I was at all the high levels. My cholesterol was high, my blood pressure was high, my blood sugar was high. It was a wake-up call, and it freaked me out, and I made an appointment with my doctor as soon as I got back to my desk, and I went to him that day.
We were concerned, and a few days later we called to follow up on her. Irene, did you see your physician? She did, and then she ran with it.
Words go around, I guess, that way, right?
Okay.
Irene was surprised to find out she's diabetic. She's not relying simply on medication to take control.
I have changed the way I eat. I exercise every day. It was an eye-opener. We're going to Charlie Daniels tonight.
Oh, really?
On her morning and afternoon breaks at her job, Irene and some of her fellow employees hit the pavement instead of the snack machine. All of these lifestyle changes are paying off. She calls it her journey.
It's a long and often difficult process of personal change and development.
And she's keeping up with that journey in a notebook. She's lost 40 pounds in 12 months, and her last blood work was in the normal range.
On my last blood work, he put great.
Muy bien.
Nurse Beth Davenport of Baptist Health System says knowing your numbers is crucial and can empower you to have an aha moment that can change your life.
Our goal is to identify these risk factors early on so that person can make the changes in their lifestyle that they need to, or see a physician if their values are really abnormal.
The first number you should know, blood pressure. The ideal goal is 120/80.
We want to watch our blood pressure. They call it the silent killer for a reason. It can lead to heart attack and stroke.
You also need to keep track of cholesterol. A total number of 200 or less is considered healthy.
High cholesterol can lead to the hardening of the arteries. Okay, we want to make sure that we're really keeping our arteries healthy.
And finally, glucose or blood sugar level. It can be an indicator of diabetes risk. A fasting glucose number of 60 to 100 or a non-fasting glucose level of 70 to 140 is the goal.
Diabetes is one of the leading disease states in the city of San Antonio, in the state of Texas, and in the United States. It goes hand in hand with the obesity crisis that's occurring within our country right now.
Irene is happy with her progress and is serving as an inspiration to others. She's grateful to Baptist for the screening program, an outreach that touches thousands of South Texans every year.
I owe my life to them.
She's like our poster child. She's awesome. You can't even imagine how good that makes you feel to realize that something you've said has sunk in, something you have said has made an impact on that person's life.
Helping people know their numbers and add them up to a healthy future. That's the difference. That's Baptist Care. If you need to know your numbers, make an appointment with a primary care provider. It's the first step in taking control of your health. To find a physician, call 866-217-4742. For the Baptist Health News Network, I'm Wendy Rigby.